Continuing our discussion with the lower limb gross anatomy, our next chapter is the popliteal fossa. In popliteal fossa, we are going to discuss about the anatomical boundaries and the contents of the popliteal fossa, and also we are going to study about the cutaneous nerves which are present in it, and we will discuss in detail about the tibial nerve, and also we will discuss about the popliteal artery and popliteal vein. Okay, so these are the contents we are going to discuss in the popliteal fossa. So let us start our discussion with the popliteal fossa anatomy along with its boundaries and its contents. Okay, so we are going to discuss about the popliteal fossa. Popliteal fossa. So the location of the popliteal fossa, the anatomical location of the popliteal fossa can be seen at the back of the knee or the posterior aspect of the knee joint. So this popliteal fossa can be felt as a depression at the back of the knee, and this depression is a diamond shaped depression mainly formed by four muscles. So let us first discuss about what are the boundaries of the popliteal fossa. So here, if you see the popliteal fossa, the diamond shaped depression which is present at the center is called as popliteal fossa. Here it is formed by superolaterally, it is formed by the superolaterally biceps femoris muscle, the superolaterally, that is the superolateral boundary. We are going to discuss about the boundaries of the popliteal fossa. The superolateral boundary is formed by the biceps femoris. We'll think this is the lateral and this is the medial. Okay, and here the supromedial boundary. The supromedial boundary is formed by this muscle is called as semi-membranous, formed by semi-membranous and semi-tendinous. The supromedial boundary is formed by the semi-membranous and semi-tendinous, and inferiorly again we have two boundaries. One is the infralateral boundary and another one is the inframedial boundary. Okay, so here the infralateral boundary is formed by the lateral head of gastrocnemius, as well as you can see here plantaris, lateral head of gastrocnemius and plantaris, and inframedially, this is infralaterally, the boundary is formed by the lateral head of gastrocnemius, and inframedially it is formed by the medial head. It is formed by the medial head of gastrocnemius muscle. So these are the boundaries which form the popliteal fossa, which is a diamond shaped depression which can be felt at the back of the knee. If you see, the boundaries are totally four boundaries. I will repeat again. The four boundaries are the superolateral boundary formed by the biceps femoris. Superomedial boundary is formed by semi-membranous and semi-tendinous, and other muscles also take part in the supromedial boundary, that is gracilis, sartorius as well as adductor magnus, but the main boundaries supromedially, that is supromedially the main boundaries are formed by the semi-membranous as well as semi-tendinous. Okay, like that a diamond shaped depression is created at the back of the knee. This is called as the popliteal fossa, right? So if you see the popliteal fossa, this is what you are seeing from the posterior view of the popliteal fossa. If you see the popliteal fossa, it also has the roof as well as floor. The popliteal fossa also contains the roof and floor. So first let us discuss about the roof here. The roof of the popliteal fossa, that is the covering here, the roof of the popliteal fossa is mainly formed by the deep fascia. The deep fascia is also called as the popliteal fascia, and above the deep fascia it is covered by the superficial fascia and the skin. So what are the structures which are forming the roof of the popliteal fossa here? The roof is formed by the deep fascia, above the deep fascia, that is covering to the deep fascia, a superficial fascia and the skin. If you see the superficial fascia which is covering the popliteal fossa, the superficial fascia contains the short saphenous vein and 3 cutaneous nerves. So these structures are very important to know here. What are the contents of the superficial fascia here? Superficial fascia. So the superficial fascia of the popliteal fossa forms the roof of the popliteal fossa. Mainly it contains the short saphenous vein, and second one, they contain important 3 cutaneous nerves. What are the contents? It contains the short saphenous vein and it contains 3 cutaneous nerves. So what are the 3 cutaneous nerves? We will see A, B and C. So we studied about the posterior cutaneous nerve of the thigh, right? So this posterior cutaneous nerve of the thigh, when we studied in the gluteal region, there we studied that it pierces the deep fascia at the back of the thigh. So by piercing the deep fascia at the back of the thigh, mainly it will become superficial at the popliteal fossa, where it is present at the superficial fascia, right? So the first branch is called as the posterior cutaneous nerve of thigh. Posterior cutaneous nerve of the thigh. So by the time posterior cutaneous nerve of the thigh reaches the superficial fascia of the popliteal region, it terminates in that area. That's why we can say that the terminal branch of the posterior cutaneous nerve of the thigh present at the middle part of the superficial fascia of popliteal region. Okay, so if you see this, I will draw, this is the posterior cutaneous nerve of the thigh, exactly comes from the middle of the popliteal fossa. From deep it will become superficial, by the time it reaches the popliteal fossa. That is the reason I can say that out of 3 cutaneous nerves, the first cutaneous nerve, which is present at the superficial fascia of the popliteal fossa, contains the terminal branch of posterior cutaneous nerve of the thigh. And second one, another nerve enters here, another cutaneous nerve reaches the superficial fascia. Another cutaneous nerve reaches the superficial fascia of the popliteal region. This nerve is called as the posterior division of medial cutaneous nerve of thigh. Posterior division of medial cutaneous nerve of the thigh. Next, the another nerve which is seen to towards the lateral aspect is called as the sural nerve or peroneal communicating nerve. It is the sural nerve or peroneal communicating nerve. So these are the three cutaneous nerves which are present in the superficial fascia which forms the roof of the popliteal fossa. What are they? The first one is posterior cutaneous nerve of the thigh, and the second one is posterior division of medial cutaneous nerve of thigh. Medial cutaneous nerve of the thigh, that is posterior division, and the third one is called as the sural nerve, also known as the what communicating branch? Peroneal communicating branch. So like that, the contents of the superficial fascia are short saphenous vein and the three cutaneous nerves here. Okay. So like that, the roof is mainly formed by the deep fascia, which is also called as popliteal fascia. Second, the three cutaneous nerves, as well as it is formed by the skin, superficial fascia as well as the skin. So these are the structures which forms the roof of the popliteal fossa. Next we will see what are the structures which forms the floor of the popliteal fossa. Okay, so if you see this structure here, this is the femur. You are seeing the knee joint from the lateral aspect here. So this is the femur here, and this is the tibia, femur and tibia. This is the capsule of knee joint. This is the capsule of the knee joint. So if you see the popliteal fossa, this entire area is the popliteal fossa, right? So from lateral aspect, if you see this area, this entire area forms the popliteal fossa. From the lateral aspect, if you see, this is the area which forms the popliteal fossa. So if you see the floor of the popliteal fossa from superior to inferior, it forms the popliteal surface of the femur. This is called as the popliteal surface of the femur. The floor is formed by the popliteal surface of the femur, right? The first point, the floor is formed by the popliteal surface of the femur. The second point here is it is formed by the capsule of the knee joint. Here you can see this is called as the capsule of the knee joint, and it is formed by the fascia covering popliteus muscle and also the strong popliteal ligament. This is the popliteus muscle. This is the fascia covering the popliteus muscle. So the third point is it is formed by the fascia covering popliteus muscle as well as strong popliteal ligament. Understood? So these are the structures which are mainly seen at the floor. So by this we came to know the organization of the popliteal fossa. That is how the popliteal fossa is formed, how a diamond-shaped depression is created at the back of the knee. There are totally 4 boundaries. The 4 boundaries are formed by the superolateral boundary, superomedial boundary, and as well as infralateral boundary and inframedial boundary, right? So these are the muscles which are forming these boundaries. Afterwards, the popliteal fossa also has the roof as well as floor. The roof is formed by the deep fascia, superficial fascia and the skin, and the floor is mainly formed by the popliteal surface of the femur, capsule of the knee joint, and the fascia which covers the popliteus muscle and the strong popliteal ligament. Understood, right? So these are the anatomical boundaries of the popliteal fossa. After that, the important part we have to know about the popliteal fossa is what are the contents of the popliteal fossa. So let us study one by one. So here we are going to study about the contents of the popliteal fossa. We are going to study about the contents here contents of the popliteal fossa. Okay. First, if you see the contents of the popliteal fossa, you can see the artery. The artery is called as the popliteal artery. First is popliteal artery. Okay, popliteal artery as well as its branches. Here I did not draw the branches. Later we can study what are the branches which are formed. But the popliteal artery and its branches. And the second one, immediately beside the popliteal artery, you can see the popliteal vein. So we will write the popliteal vein and its tributaries. Popliteal artery and its branches. We are studying about the contents of the popliteal fossa, the popliteal artery and its branches, the popliteal vein and its tributaries, and the third one, we also have the tibial nerve as well as its branches, tibial nerve and its branches, and we have the peroneal nerve, that is the common peroneal nerve. Not only this, we also have the posterior cutaneous nerve of the thigh. We also have the fifth one, posterior cutaneous nerve of the thigh. After posterior cutaneous nerve of the thigh, we have the genicular branch of obturator nerve, that is genicular branch of obturator nerve. There are totally, remember, 8 contents should present in the popliteal fossa. First, let's start from the popliteal name itself, so it is very easy to remember. So anyway, popliteal fossa contains the popliteal artery as well as popliteal vein, that is the popliteal artery and its branches, popliteal vein and its tributaries, because the direction of the blood flow of the artery is that is away from the heart, and the direction of the blood flow in the vein is towards the heart. That's why we are calling it as the tributaries, and for artery we are calling it as the branches. For vein we cannot say it as the branches, rather than we use the word called as the tributaries, right? That is the reason the popliteal vein and its tributaries. And you can see the tibial nerve as well as the peroneal nerve in this region, the tibial nerve, peroneal nerve, and just now we already studied in the center part of the popliteal fossa, we have the posterior cutaneous nerve of the thigh, and in the deeper aspect we can also see the genicular branch of the obturator nerve, and also we have popliteal lymph nodes, and there is a fat, and there is a content of fat. So these are the 8 contents. You have to remember, these are the contents which are present in the popliteal fossa. So by this we finished what are the boundaries of the popliteal fossa, and along with the boundaries we studied about how the roof, what are the structures which are present in the roof, and what are the structures which are forming the floor, and also we studied all the contents which are present in this region. After the popliteal fossa, now we are going to discuss about the anatomy of popliteal artery. So first let us see the course of the popliteal artery as well as the distribution, and finally we discuss about the branches of the popliteal artery here. So as you studied in the lower limb arteries, the external iliac artery behind the inguinal ligaments continues as a femoral artery. Afterwards the femoral artery is enclosed in the femoral sheath, that is seen in the femoral triangle, and finally the femoral artery terminates after passing through the adductor hiatus, that is the opening which is present in the adductor magnus, right? So here if you see this muscle is called as the adductor magnus muscle. This is the adductor magnus muscle, and in the adductor magnus muscle whatever you are seeing, this is called as the opening of the adductor magnus, called as the adductor hiatus. This is the opening of the adductor magnus. This is called as the adductor hiatus. And this is the femoral artery. After it passes through the opening of the adductor magnus or adductor hiatus, it continues as a popliteal artery. Okay? So, what is the origin of the popliteal artery here? The popliteal artery formation takes place in the opening of the adductor magnus. It is also called as the adductor hiatus, right? After the artery forms in the hiatus of adductor magnus, it runs downwards and laterally, right? It runs downwards and laterally. Finally, to reach the lower border of popliteus muscle. If you say this, this is called as the lower border of the popliteus muscle. This is the popliteus muscle. So this is the lower border of popliteus muscle. After the popliteal artery reaches the lower border of the popliteus muscle, the artery gives off two branches or terminates into the anterior as well as posterior tibial arteries, right? Where at the lower border of the popliteus muscle, the popliteal artery terminates by giving, this is the anterior tibial artery, and the continuation is called as the posterior tibial artery. So if you see, this is the fibula. So between the fibula as well as tibial bone, you have the interosseous membrane. The anterior tibial artery piercing the upper part of the interosseous membrane to reach anterior aspect of the leg, where it forms the anterior tibial artery and continues to supply the anterior aspect of the leg. And posteriorly, it continues as a posterior tibial artery. So this is the origin, this is the course, and this is the termination, right, of the popliteal artery. And if you see, what are the relations of the popliteal artery in the popliteal fossa here, where it is exactly located, and how the popliteal artery is related to other structures. So one point you should know here, that you have the popliteal vein as well as tibial nerve, as well as in the popliteal fossa you have the popliteal artery. Out of these three structures, let us take these three structures into consideration. Out of these three structures, the popliteal artery is considered to be the deepest structure out of all the three. For example, if you see this as a, let us assume this as a popliteal artery here. This is the popliteal artery, and I am telling you that this popliteal artery is lying at the deeper aspect of the popliteal fossa, right? It is lying at the deeper aspect of the popliteal fossa, and superficial to this popliteal artery, you can see here, superficial to this popliteal artery, what you have? You have vein. This is the popliteal vein. Deeper you have the popliteal artery. Above the popliteal artery means you are seeing from posteriorly. If you see from anteriorly, the anterior most part is called as the popliteal artery. Posteriorly you have the popliteal vein, and above the popliteal vein you have the tibial nerve. Like that. That is the reason I am saying you that the popliteal artery is considered to be a deepest structure which is present in the popliteal fossa. So that is the reason you can say that if you want to explain about the relations of the popliteal artery in the popliteal fossa, you can say posterior or superficial. Because if you see from back side, it is superficial, right? And if you see from anterior, it is called as posterior. So that is the reason you can say posteriorly or superficially. Okay. So before that, first I want to tell you the relations of the popliteal artery here. I want to tell you the relations of the popliteal artery. In the relations, first let us discuss about anterior relations. Okay, or you can say deep relations. Anterior relations or deep relations. Okay. So let's see this picture. Remember, I told you this is the popliteal fossa. The floor of the popliteal fossa is formed by, again we will review, the floor of the popliteal fossa is formed by the popliteal surface of the femur, the capsule of the knee joint, and oblique popliteal ligament, that is strong popliteal ligament, and also the fascia covering the popliteus muscle. These are the structures which are forming the floor of the popliteal fossa. Now I am saying that the popliteal artery is the deepest structure here, right? So this is the popliteal artery, this is the deepest structure here. So if this is the posterior view, this is the anterior view, right? Because you are seeing from laterally, that is the posterior view, you have the popliteal fossa, and this is the anterior view. So if you see the relations, what are the anterior relations of the artery? Now I am explaining about the anterior relations. Anterior relations of the popliteal artery. What are the anterior relations here? Same, the anterior relations of the popliteal artery as well as the structures which are forming the floor of the popliteal artery are same. The anterior relations are what it is? The popliteal surface of the femur, the capsule of the knee joint, and also the fascia covering the popliteus muscle, or you can say the back of the knee joint is the anterior relations, right? The back of the knee joint, that is capsule of the knee joint, popliteal surface of the femur, and the fascia covering the popliteus muscle are the anterior relations. Okay, so that's the anterior relations. I can explain you that there are three anterior relations. One is called as the popliteal surface of femur, right? The anterior relations, popliteal surface of femur, and next is the capsule of knee joint, or you can say the back of the knee, and next is the fascia covering the popliteus muscle, because this is the popliteus muscle. So now I can say that fascia covering popliteus. These are the anterior relations of popliteal artery. Anterior relations of popliteal artery, right? After we study the anterior relations, now let us study what are the posterior relations. What are the posterior relations? So we can also say that they are the superficial relations. Okay, what are the posterior relations and what are the superficial relations? Immediately posterior to the artery, you have the vein, that is called as the popliteal vein. So this is the popliteal vein here, and more posteriorly or more superficially, you have the more superficially or more posteriorly, you have the tibial nerve. So this is the tibial nerve. So what is this? This is the PA, popliteal artery. More posteriorly, you have popliteal vein, and more posteriorly, you have the tibial nerve. Understood? So from lateral aspect, you are seeing these structures. If you see this is the popliteal artery, and this is towards the lateral side and this is towards the medial side. If you know the course of the popliteal artery, you know that from the hiatus of the adductor magnus or adductor hiatus, opening of the adductor magnus, that is adductor hiatus, the artery and the femoral artery continues as a popliteal artery, as you studied it runs downwards laterally. Same thing, it runs downwards laterally because this is the lateral side, because you can see fibula here, runs downwards laterally. And I said you that the popliteal artery is the most posterior structure, right? So the popliteal artery is the most posterior structure. So now what is happening here? It is mainly enveloped by, I can show you, it is mainly crossed by the popliteal vein. Here you can see the popliteal vein is crossing. Popliteal vein is crossing the popliteal artery at the center. At the same way, this is called as the tibial nerve. Tibial nerve is also crossing anterior to the popliteal artery as well as popliteal vein. So the most posterior structure is popliteal artery, and popliteal artery is crossed by the popliteal vein, and popliteal vein as well as popliteal artery is crossed by the tibial nerve. Okay, so now let us divide like this. In uppermost aspect of the popliteal fossa, in upper part of the popliteal fossa, what are the structures which are related? First let us see what are the structures which are related laterally. Then it is very easy to remember. Let us see all the structures which are related laterally. Okay. Here the upper part of the artery, we are talking about lateral relations to the artery, entire course. In the upper part of the artery, it is related to the, I will write upper part. UP means upper part. In the upper part, the lateral relations are popliteal vein. Immediately after the popliteal vein, you have the tibial nerve, popliteal vein as well as tibial nerve. And laterally, what are the structures which are present laterally? Biceps femoris, right? The upper part of the artery is related to the tibial nerve, popliteal vein as well as biceps femoris. Here you can see biceps femoris. And laterally, what is the structure? This structure is called as the lateral condyle of the femur. That is lateral condyle of femur. So laterally it is related to the lateral condyle of femur. So these are all the relations of the upper part of the artery here. Okay. And in the lower part of the artery, it is related to the corresponding tibial condyle, that is the lateral tibial condyle, right? So, and in the lower part, if you see, this is laterally. So laterally it is related to the biceps femoris muscle, and laterally not only it is related to the corresponding tibial condyles, it is also related to the lateral head of the biceps femoris and plantaris. So here in the upper part, now I will write LP called as the lower part. In the lower part it is related to the corresponding tibial condyle, and it is related to the lateral head of the biceps femoris as well as plantaris. Lateral head of biceps femoris as well as plantaris. I think you understood here. I will repeat. The popliteal artery is considered to be the deepest structure which is present in the popliteal fossa, and which is crossed by the popliteal vein as well as popliteal artery. Here you can see the popliteal artery is the most deepest structure, and posteriorly have the popliteal vein, or you can say superficially, and posteriorly have the tibial nerve, right? And if you see the upper part of the artery, the popliteal vein, this is the popliteal vein, is lateral to the artery, and tibial nerve also lateral to the artery, and you have biceps femoris muscle here because it forms the supralateral boundary of the popliteal fossa, and it is related to the lateral condyle of the femur, and in the lower part it is related to the corresponding condyle of the tibia, and you also have the lateral head of the what muscle? The lateral head of the gastrocnemius. The lateral head of the gastrocnemius, right? And not only the lateral head of the gastrocnemius, you also have the plantaris, right? In upper part is the biceps femoris, and in the lower part the lateral head of the gastrocnemius as well as plantaris muscle, right? These are the lateral relations. In the lateral relations, upper part and lower part relations we studied here. Next, what are the relations which are present medially? So we will study the medial relations. In the medial relations also there is the upper part as well as lower part. So in the medially, same thing. What are the medial relations in its upper part? In the upper part, it is related to the muscle called as semi-membranous, because you know medially it is related to the semi-membranous and semi-tendinous, forms the supramedial portion of the popliteal fossa, right? In the same way, in the upper medial part, it forms the boundary, or it forms relation to the semi-membranous, and also the corresponding condyle of the femur, that is the medial condyle of the femur. What are the relations of the popliteal artery medially? In its upper part, it is related to the semi-membranous and semi-tendinous and medial condyle of the femur, and in the lower part, it is related medially to the popliteal vein as well as the tibial nerve, and also the medial head of the gastrocnemius, right? Medial head of the gastrocnemius. So these are the relations of the popliteal artery what we studied. We studied about anterior relations, we studied about posterior relations, in that superficial relations, as well as we studied about lateral relations, as well as we studied about the medial relations. Now what are the branches of the popliteal artery? So the upper 2 or 3 muscular branches, means popliteal artery has mainly 2 or 3 muscular branches. Like that you have the upper muscular branches as well as lower muscular branches. The upper muscular branches mainly supplies the adductor magnus and hamstrings. The upper muscular branches mainly supplies adductor magnus and hamstrings, but the lower muscular branches mainly supplies the gastrocnemius, soleus as well as plantaris. The lower muscular branches mainly supplies gastrocnemius, soleus as well as plantaris. And is there any cutaneous branch, cutaneous artery which is arising from this? Yes, there is one cutaneous branch arise directly from the popliteal artery or indirectly from its muscular branches. The cutaneous artery may arise directly from the popliteal artery, or it may arise indirectly from the muscular branches of the popliteal artery, right? So after we know this, let us study about the genicular branches. There are totally 5 genicular branches. 5 genicular branches are there totally. So genicular branches are 5. What are those genicular branches? We will see here. Okay. What are the genicular branches of the popliteal artery? So if you see the popliteal artery here, like this, the popliteal artery has 2 genicular branches in its upper part as well as 2 genicular branches in its lower part. These are the 2 genicular branches. There are totally 5 genicular branches. 1, 2, 3, 4. 5 genicular branches. Another genicular branch which is in the middle called as the middle genicular branch. 5. The popliteal artery totally has 5 branches called as genicular branches. So these are the 2 genicular branches. We can also say they are called as the superior genicular branches. Like that you can say supralateral genicular branch, supramedial genicular branch. In the same way here I can say infralateral genicular branch, inframedial genicular branch, and a middle genicular branch. Like that, the popliteal artery has totally 5 genicular branches. What they are? Suprolateral, supromedial, infralateral, infromedial and middle. Okay. The fifth one, that is the middle genicular branch, mainly pierces the cruciate ligament of the knee joint and also supplies the capsule of the knee joint. Capsule of knee joint. It supplies the capsule of the knee joint. Okay. And if you see the genicular branches, that is supralateral, supromedial, infralateral and infromedial genicular branches, these genicular branches runs anteriorly towards the knee, where it take part in the anastomosis around the knee joint. All these 4 genicular branches, supralateral, supromedial, infralateral, infromedial, runs towards the anterior aspect of the knee, where they finally take part in the anastomosis around the knee. Okay, this is what we should know about the popliteal artery.